I'm Dr. Hardeep Singh Bawa, consultant physician, internal medicine. So today we will talk about the hypertension. So we will learn how to control the blood pressure and what will be the causes of hypertension. So first of all, understanding hypertension. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, each time when our heart beats, it generate and or it pump a blood in into the arteries. So when it pump the blood into the artery, then the pressure creates inside the artery. That pressure is called a blood pressure. So when the blood pressure rises for a long time without untreated, then we call this hypertension. So there are few factors which involved in the hypertension, like age, stress factor, food, unhealthy lifestyle, high salt intake. So these are the main factors for hypertension. So we will discuss each and everything one by one. So age. In age, as the people get older, the arteries can stiffen up and narrow as excess fat build inside of the arteries. So it will decrease the circumference of the arteries and the pressure raise inside the arteries. So there are a family history of hypertension. These people can get a hypertension. Some people take high salt intake, so these people have a hypertension. Eating unhealthy diet like more fat inside the meal can one of the cause of hypertension. Another one is stress. Reacting to stress in unhealthy way or not managing stress can also increase the blood pressure. Moving on, hypertension. Hypertension does not have any obvious sign and symptom. That's why it often called as a silent killer. It put people at risk for several diseases from cardiovascular, CKD, chronic kidney failure, stroke, etc. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to diagnose the hypertension or high blood pressure. Generally, when symptoms do occur, they includes morning headache, tiredness, vision problems, diplopia sometime, fatigue, or nausea and vomiting. Fortunately, high pressure can easily diagnosed. It is usually measured with an instrument called a sphygmomanometer. A blood pressure is recorded in two numbers, systolic and diastolic. Now let's try and understand what do the number accurately means. A healthy and normal blood pressure is 120 systolic and 80 diastolic mm of mercury. So according to American Heart Association, it varies from 60 to 89 is a diastolic. It considered as a normal blood pressure, and 100 to 124 mm of mercury is considered as a normal systolic blood pressure. If blood pressure is more than 125 systolic and more than 90 diastolic is considered as a high blood pressure. Moving on, the risk can be prevented and reduced by taking steps towards the healthier lifestyle like regular exercise, low fat inside the meal, and low salt intake, less stress, and manage stress accordingly. Smoking, the peoples who are smoker, they also have a narrow arterioles, and they also we consider as a hypertensive. So quiet smoking is also one of reduce the hypertension. Stress management, how to manage the stress. By learning how to relax and manage stress can improve emotional and physical health and lower high blood pressure. Stress management include exercise, listening to music, focusing on something calm or peaceful, and meditations. Adherence to medicine. A medicine to lower blood pressure may be recommended by a doctor. If your blood pressure is more than 140 systolic and more than 90 diastolic, then you can consult your doctor and take a prescribed medicine for your blood pressure. So, thank you very much.